Now, whenever we talk about metabolism or a person's metabolic rate, there are three organs, three glands that we concentrate on: the adrenal glands, the thyroid, and the pancreas. And if any one of those three glands is out of balance, out of sync, as we say, with the other two, then we might have an issue with your metabolic rate. And usually, most of the time, it's the thyroid that seems to be the one that goes out of balance. How do you know if you've got an issue with your thyroid gland? I mean, you can go to the laboratory and have some blood taken, and they'll tell you whether or not you've got thyroid issues. But there are certain signs you should be looking for, and then we'll give you a little quiz later on about these signs. But let me list for you the signs, the symptoms, really, of having some problem with being out of balance between the thyroid, the adrenals, and the pancreas. Let's look at some of the symptoms and signs of this system being out of balance: thyroid, adrenal, and pancreas. Number one, are you suffering from any kind of allergies, food sensitivities? That is an issue. Number two, is there anemia running in your body? Do you have low amount of red blood cells? Do you have angina? Do you have chest pain? Do you have hardening of the arteries? Now we get into some of the more common symptoms that we see in patients: brittle nails, constant chronic and frequent infections. You're always getting sick. Your hands and feet are cold all the time. You are definitely constipated. You are one of those people that just is always constipated. You're depressed too. You've got all sorts of difficulty losing weight. You've got digestive problems all the time. Either you've got gas or bloating. As I said, you've got constipation. You're always distended. You never have a satisfying bowel movement. There's always more to do, which you can't seem to get done. So these digestive problems. But you're also noticing that your skin is drier than it used to be. You're noticing that you're losing a little bit of hair. You're tired all the time as well. You're starting to have some headaches and maybe even some irregular rhythm of your heart. Now, of course, we don't expect a person to have all of these symptoms, but if you've got 3, 4, or 5 of them, you should, start paying attention to what's going on. Other symptoms might be irregular menstrual periods, lethargy. You're just tired. You just, you're, as one of my students once said, my get up and go got up and went. You're just always tired. Your appetite is suppressed. Your libido is not what you want it to be. There's just very little sex drive. And boy, as I mentioned to you before, I am seeing more and more and more issues around decreased libido in middle-aged women that are, in their 30s and 40s that should be in their sexual prime, are just not with it when it comes to sex drive. A lot of that has to do with thyroid dysfunction. Also, we find people have memory issues, what somebody called recently in my lab mental sluggishness. He said, I'm working, I'm doing my job, but my brain feels sluggish. You know how your body feels sluggish sometimes? You just can't get it going? Well, your brain can get sluggish as well. And he used that interesting term, mental sluggishness, to describe how he was feeling. Also, muscular weakness. We actually see sometimes muscular atrophy. There's slowness of movement. You notice that your joints are stiff. Your body hurts. When you get a cut or a scratch, it doesn't heal as rapidly as it used to. And so these are the common signs and symptoms of hypothyroidism, or an abnormality in that functioning, that triad of adrenal, thyroid, and pancreas. When I teach a class on this, the first thing I do when I walk into the classroom is I put a big triangle on the board. The top of the triangle is thyroid function. Sometimes I'll make a triangle upside down so that the base, that pointy base, is thyroid function. On one of the corners I will put adrenal function. On one of the other corners I will put pancreatic function. And right across the middle I'm going to write metabolic rate or metabolism, because it is controlled by the combination of adrenal, thyroid, and pancreatic function. And it's usually the thyroid function that messes everything up, because if you have an error in any one of these three glands, it impacts immediately and directly the function of the other two. So if you've got a sluggishness of the thyroid, you're going to have sluggish adrenal function and sluggish pancreatic function. And pancreas has a lot to do with your metabolic rate. It controls sugar metabolism. It secretes insulin, a major hormone that controls your metabolic rate and energy and vitality and so on. So this is all really important. So when we see a patient that complains of these constant cold hands and feet and digestive issues and depression, doc, I just can't lose weight no matter what program I put myself on, I just can't lose weight. And look at my skin, it's all dry. Look at my hair, it's lethargic. My hair is dried up. I'm losing hair. I'm always, I'm getting sick. I'm totally lethargic. My appetite really is terrible, but I just keep overeating carbohydrates. My sex drive is out the window. I've got some memory problems. I feel brain sluggishness. What's going on? Well, most of the time, it is a hypothyroid disorder.